with that, I think that's a good segue into our final panel on other revenue sources. We have with us Jason Cisney, Chief Deputy Legislative Analyst, State and Local Finance. Thank you to all of our prior panel members and presenters for your contributions and presentations. Whenever you're ready, Mr. Cisney.
Jason Cisney from the LAO. Prior to coming up here, you were discussing healthcare-related taxes, which obviously are a pretty specialized area of taxes. We've been asked here for this committee and also on the Senate side to talk about other revenue options. In a sense, your other revenue options are really any area of taxation, because the legislature has a broad power under the Constitution to tax with a 2/3 vote to enact new taxes. You would have a wide range of options if you wanted to pursue other non-healthcare related taxes as a possible funding source in this area. The handout really is quite brief and has a couple of pages. On the first page, it covers some particular taxes that we were asked to provide some background on, taxes in the areas of alcohol, tobacco, and high-calorie foods and beverages. These are taxes where there is a nexus with healthcare-related cost. So some would say that the state's total level of taxation in these areas should theoretically be set to cover public health costs related to the conditions connected to these substances. For example, in the area of tobacco, there are health-related costs, and in theory, you could set the level of taxation to cover those public health costs and certain other social costs. The challenge in that area, though, is that it's very difficult to define what those cost levels are. And if you were to ask experts to look at that, you would have a variety of different opinions, and it would be a very complex topic to discuss. But the bottom line is you do have options in all of these areas that could produce substantial revenue. And as with any tax, you would have to decide how to allocate it to Medi-Cal, developmental services, or other programs in the state budget. On the last page, in response to some questions we've received, we also talk about the very broad topic of the state's tax credits, deductions, and other tax expenditures. Changing these would be one way to raise revenue, but as in any area of taxation, as was just being discussed in the context of the MCO tax and other healthcare-related taxes, there are winners and losers. So none of these decisions are easy for a legislature to make. But I think the bottom line is that with the area of tax credits, there are many tax credits. Many of them are very popular, but there are many ways that the legislature has considered over time changing them to increase revenues for various public purposes. So with that very brief introduction in the handout, happy to answer any questions.
Assemblymember Bonilla.
On the alcohol beverage tax, you have the one for by the gallon, but isn't there also a mixed drink tax currently, or is that a separate tax that could be considered?
I believe at the state level that would be a separate tax to be considered. On the excise tax, this is how the state taxes these beverages per gallon. But I'll look into that and provide your staff with additional information.
Well, I think it's a little bit different when it's a mixed drink, and I think that the other thing I would think would be really helpful information is a comparison of what our taxes are for alcohol compared to other states. As I understand it, we're traditionally very, very low compared to the 50 states.
It's very difficult to compare excise taxes for alcohol from one state to the other. States tax them in different ways. But in general, the data I've seen indicates that California is in the lower half of states, and it varies by beverage, where typically we have a very low wine tax rate. California is obviously a major wine producer.
Jim Wood, don't jump up.
Very low wine tax rate, and for beer and spirits, some data I've seen also indicates below average. But we'll also share some comparisons of that with your staff, SAVs, so that you can see that information as well.
We've also been actively have bills right now considering the regulation of medical marijuana. And there's quite a discussion around the different impacts. Mr. Wood has a bill on putting money from growing marijuana back in to restore the environment. There's just a lot of talk about those revenues. But is that something you've considered, seeing as how it's actually kind of in the realm of medicine?
That would obviously be an option, and obviously a lot of discussion going on both here in the legislature as well as potentially through the initiative process. We do often evaluate marijuana taxation and legalization proposals through the initiative process. Mm-hmm. So I don't have any estimates, readily available to give you, but that clearly is an option you have as well.
And I mean, we're just talking about medical marijuana in the legislature at this time. I don't know what the future might hold, but even in that realm, I mean, a lot of the money would go to just setting up a regulatory structure. But I just think this might be one of the elements that we want to, we could possibly consider.
And as I said, we'll provide more information through your staffs on those issues, and obviously eager to assist as you consider other proposals as well.
Can you also comment in the same vein that you did about how the alcoholic beverage taxes in California compare to other states? Can you share how the tobacco tax in California compares to other states?
With regard to cigarettes, my understanding is that incorporating the tax changes that various states are implementing this summer, California's would rank around 35th out of the 50 states. So in the lower half of states, I think there are 6 states this summer implementing new tax increases that is knocking California's ranking down several notches there.
Is there an average or a mean tax rate for the states in the United States that have them, and where does California fit vis-a-vis that?
Consulting some data here.
Please.
I
know it's very
believe
specific.
the median, looking right now at the states, I'm looking right now for the 25th, 26th, the 26th state, South Dakota, is around $1.50 a pack, and California is at 87 cents. So around the middle there, at least in terms of the median, seems to be around $1.50, and California is substantially less than that.
Assemblymember Bonilla.
Well, maybe in light of the action or lack of action that was taken yesterday, we need to consider e-cigarettes as part of this. Whether or not they're tobacco, let's just throw them into the mix.
I'll second that.
Any other comments or questions from members on this topic? Thank you, Mr. Cisney. Appreciate it. Let's go to public comment. We have a microphone set up, and we can just line up for comment.
Thank you. Good afternoon, Mr. Chairman and members. Apologize for my relaxed attire. Didn't think you were taking public comment today. But in any event, I'm here on behalf of 2 distinct groups of Medi-Cal patients, one being dialysis patients. The 10% cut has discouraged and inhibited dialysis providers from building new capacity. And this is going to be crucial as we go forward, because there is not going to be sufficient capacity for new patients suffering from end-stage renal disease unless some kind of rate increase or rate restoration takes place in the near future. That's a very important point. It's also the rate cut has diminished the availability of non-emergency medical transportation. That transportation is only given to patients who exhibit medical conditions that render them incapable of riding in a bus or car. They need the patient safety features of non-emergency medical transportation as it is set forth in Medi-Cal regulations. The second group I'd like to mention is a new group of Medi-Cal beneficiaries that were brought in by the ACA, and that's the persons under 65, over 21, non-disabled, no families. This is a new group, and they are able to generate 100% federal match. I'm talking in terms of their eyeglasses. This new group, under current law, can get a routine eye exam. They can get a refraction prescription, but Medi-Cal won't cover their eyeglasses. Now, this is a group of people who, with eyeglasses and being of working age, could conceivably find jobs and go back to work and maybe get off the Medi-Cal rolls. It's not that expensive. It was an optional. It was deleted in 2009. There's no reason now not to restore it. It would make perfect economic sense. So on behalf of those two groups, we'd like to urge consideration of their special needs. Thank you very much.
Thank you.
Good afternoon, Mr. Chair and members. My name is Tam Ma, and I am with Health Access California. We are the statewide healthcare consumer advocacy coalition dedicated to advocating for quality and affordable health care for all Californians. We support a broad-based MCO tax that conforms with federal guidelines because this is an important sustainable revenue source for the Medi-Cal program. Health Access also supports other revenue measures to raise the resources needed to increase access to Medi-Cal and to fund restorations that have received bipartisan support in this legislature. They include an increase in the Medi-Cal provider rates, restoration of optional benefits such as the ones that the previous testifier spoke to, including adult dental, podiatry, speech therapy, and acupuncture, and as well as changing our state's Medi-Cal estate recovery policy to have a fair policy where Medi-Cal beneficiaries do not have to choose between keeping their homes and getting health care. So we very much appreciate your convening of this informational hearing, and we look forward to working with you and with the administration through this process. Thank you.
Thank you.
Hi, my name is Carol McKinney, and I'm Executive Director of Harmony Home Associated, and we provide independent living and supported living services in Contra Costa County. I'm also the co-chair of governmental affairs for the California Supported Living Network. I'd like to start off by thanking Assemblymember Thurman for pointing out that the urgency of our system. And I'd also like to thank Assemblymember Bonilla for pointing out that this is not truly a 10% increase, but a restoration of cuts and freezes that we've experienced over the years. I'd also like to mention that I'm on the task force of developmental services, and we are a long way from completing our charge. We are in the broad brush phase of this. We haven't gotten into the detail whatsoever. So when we're talking about waiting until the task force has completed its charge, so taking a look at what the system needs, we have a crumbling system now, and we really need some help at this point in time. And then we can continue with our charge of looking at how services might be delivered and rates might be structured within our system. Recently, the California Supported Living Network did a survey on people who are taking referrals for independent living and supported living. 50% of the people who responded to our survey said they were no longer going to take referrals. And of the 50% who said that they would look at referrals, they were going to look at them cautiously and would not consider taking any referrals that weren't funded completely. Thank you.
Thank you.
Mr. Chair, Sue North with the California Disability Services Association. Appreciate very much the opportunity to make some brief remarks. I'm struck listening to the sophistication and level of depth of analysis that we have available in the state when it comes to various healthcare providers. And I would simply point out to you that in the DD system, the state used to have this information. They stopped collecting it in 1998. Our cost statements no longer are submitted to the state because nobody wants to read them. They're not going to respond to what the costs actually look like. We are now 20 years into this consequence or close to it, and we've had one 2006 cost rate increase that was taken away a couple years later because of the economics of the state and the recession. We are, as Carol just said, we're a long way away from being able to give you actuarial numbers, giving you any choices of options. Our need is now, and it's very, very difficult to figure out how to proceed from here without some basic understanding that we are the horse and buggy in this conversation compared to the rest of healthcare financing. Thank you.
Thank you.
Hello, my name is Aaron Kitzman. I work at a nonprofit that operates in Los Angeles and Ventura counties, and we serve people with developmental disabilities, both children and adults. I want to thank you, Mr. Chairman, for changing your stance on the public comment. I am one of those folks who woke up at 4 a.m. to catch a plane to be here just for this hearing, so I appreciate it. Yeah, the cuts are bad. They've been bad for many, many years. We are in the process of closing one of our programs, and we're having a meeting tomorrow morning to discuss 2 other programs. And so not only is that horrible for the people we're serving, the people with disabilities, it obviously also impacts our staff who now don't have money to spend in their communities, et cetera. But one other thing, because I know there's several people behind me that I recognize that are going to tell you how bad our system is hurting and how much we need your support. Director Rogers, every time I hear him speak, he's got the Lanterman Act in his hand, and he always leads with it, and that's sort of the Bible of our system. I just wanted to read one sentence out of the Lanterman Act that I want to make sure that everybody sitting up on the dais understands. It's Section 4501. And it says, the state of California accepts the responsibility for persons with developmental disabilities and has an obligation to them which it must discharge. So again, it has an obligation to them which it must discharge. I would submit to you that over the last 10 plus years, the state of California has failed to live up to that obligation. And I strongly, strongly urge you to reconsider that and to do so.
Thank you very much.
Marty Yamoto, California Disability Senior Community Action Network, CDCAN. I'm an advocate, but I'm also a family member. My older sister, Elena, had developmental disabilities and physical disabilities. She was a regional center consumer, but also was a consumer of Medicare and Medi-Cal. She was a Medi-Medi, and she died in the year that actually Governor Schwarzenegger was going to suspend the Lanterman Act. Point one, Lanterman Act is an entitlement, but so is SSI, SSP, so is in-home supportive services, so is Medi-Cal. All those things my sister needed. All those things are things that our community needs too. Number 2, the managed care organization tax. We hope that the legislature, Democrats and Republicans, can come together and reach a resolution on that. So $1.1 billion hole will be created if we don't come together at some kind of resolution. It funds or will fund next year the restoration of IHSS, of the 7% service reduction that was cut. That is so important to 470,000 people with disabilities, including people with developmental disabilities. Number 3, urging that the legislature look at creative solutions to help our system, to help the people with this developmental disabilities in the community, looking at targeted funding where help is desperately needed this year. That includes, for instance, providing funding to providers to cover the impact of the minimum wage increases at the state and local level, which are good things, but at least fund those and fund the impact to exempt staff at the twice the minimum wage issue that Mr. Thurman, you heard yesterday, and some other members who were there at the hearing. We want those things to happen, and we just need your help. And I think the other thing that my friends and behind me and the community that was here is we want to know, what are you going to do this year to help our community and to help our families? Lastly, I'm on the Developmental Services Task Force. I've been on a lot of different task force on the Olmsted Committee, Advisory Committee. I think something's going to happen. I do think some solutions are, have a long ways to go, but what we don't know as a community is, what do you intend to do this year? Thank you.
Thank you.
Hello, my name is Stacy Sasson. I'm a director of community resources for a local supported living agency here in Sacramento. It's kind of a little running joke. Director of community resources, I don't have a lot to direct. So there's that. I know you saw in the room earlier today there were a lot of self-advocates here and a lot of staff members here that did come from a very long way to have their voices heard, and unfortunately that didn't happen. So I'm going to do my best to speak on their behalf, and I hope I do them justice. The 10% that we're asking for, that's the bare bones minimum to dig us out of a hole that has been dug for us through years and years and years of budgetary neglect. You add to that unfunded mandates like minimum wage increases, not funding 2 times minimum wage for salaried exempt staff, not funding the compression issues, and you've effectively given us budget cuts after years and years and years of no increases. So when we tweet you, when we Facebook you, when we call your offices, when we go to your offices, when we send you letters. What you're hearing in our voices and in our words is not disrespect. It's fear, it's desperation, it's hopelessness. We don't know what we're going to do. I'm sorry.
Take a moment.
Assemblymember Thurm, thank you for asking the right questions. Thank you all for saying all the beautiful words that you've said in the regular session. You've all said some beautiful words in the special session, but we're not feeling special anymore, and they're just words. We need action, and we don't need it tomorrow. We need it today. We're not giving you lip service. It's not a drill. It's not lies. We're not faking it. We need this now. This is urgent. You're right, Assemblymember Thurman. This is urgent. This is desperation. I'll be okay. I got a master's degree. I'll find another job. I'm not worried about it. I'm worried about the 280,000 people with disabilities and the people that are coming out of the developmental centers that we've fought for years to get them out of there. And what are they going to come out to? I'm worried about the staff, the people like you, Assemblymember Thurman, who are direct support staff, who don't know what they're going to do. Yeah, they deserve a living wage. Is raising the minimum wage the answer? Not without funding, it's not. You're closing the doors. Thank you. You're closing the doors of agencies like mine and shutting us out. There will be no jobs. Raise the minimum wage. Doesn't matter. There won't be any jobs. So I need you to understand. Thank you for the nice words. We appreciate it. We need action, and we need it now. Not tomorrow, today. So I'll leave you with this quote from Cuba Gooding Jr., "Show me the money." Thank you.
Thank you.
Hi, Mr. Chair and committee members. I'm Doug Pascover from Imagine Supported Living in Capitola, California. And I think, as people have pointed out, the system has been evolving, needs to evolve. There's a new vision that the federal government has presented us. There are new costs that the federal and state and you all have provided us, and we need to change with that and some targeted support to help us get from the system we are now to the sustainable, person-centered one that we are trying to become is very important, and we ask for your help.
Thank you.
Mr. Chair and members, Nick Luizos on behalf of the California Association of Health Plans. Some of my members today pay the existing managed care organization tax. Under the construct of the new federal rules, virtually all of my members would be paying the MCO tax if it were to be enacted, and that's a big difference. In the past, CAP has supported a version of the MCO tax that met some key principles for our members, including a direct benefit to the Medi-Cal program, equity among the payers of the tax, and affordability for purchasers. Unfortunately, the revised proposal that was submitted in January by the administration, in our view, did not meet those tests. But I'm trying not to be critical of our friends at the Department of Health Care Services and the administration, because it's not a matter of state policy as to why we're here. As was discussed earlier, it's the federal government and their new rules, or the enforcement of their rules, that's putting us in this position. And the restrictive nature of those rules makes it exceedingly difficult to find a funding source that doesn't lead to market dysfunction or substantial increases for the commercial market. So we are working internally with our member plans. We're working cooperatively with the Department of Health Care Services. Fortunately, the federal government, as was discussed earlier in the hearing, is giving states time until the end of their legislative sessions. And so we look forward to working with this committee and with the state on finding an alternative, if it exists, that can garner broad-based support among all the health plans. And so in the meantime, we would encourage thoughtfulness and a little bit of caution. So thank you very much.
Thank you.
Good afternoon. Thank you for giving us a moment to speak. My name is Joy, and I'm with the California Respite Association, and we provide respite to families in your community. I run a respite agency in Yuba City. I want you to understand that the 4.25% that was reinstated back to us after the cuts in 2013-14 were actually only at the level of 2008 to 2009 funding. I realize there's no money to be had for anyone, but I'd like to know how we're going to solve this problem this year, not pushing it further down the road, because pretty soon none of us will be here. You heard my colleague and my friend Stacy make that comment and heard her crying because of her employees. I am equally concerned about my employees and all of the employees in the states, plus our clients and their families, and how do we support that? How are we going to deal with this shortfall of money for these valuable services? What can we do to help with that decision? Please, we're all available to you. I would like to leave you with this final thought, that respite is the break that keeps our families from breaking.
Thank you.
I'm Jamie Davis. I run a day program in San Rafael. Assemblymember Thurman, nice to see you again. We serve about 100 people with developmental disabilities. Many of them have multiple and complex needs. I would say a third of them lived in a developmental center at one point in their lives. We have around 50 employees, 55 employees, depending on who we can hire and when we can get them on board at $12 an hour. I was talking to a colleague who's been in the field for 40 years, someone I respect very much. She started a group home, living in it, in the 70s, and now runs an agency that's 40 years old. And I've been in the field for 28 years. And we've dedicated our work lives, and she more than I, our lives, to people with developmental disabilities. And we both are very discouraged and saying, why are we doing this? It's too hard. Listening to KQED this morning, I heard on the California report about the realignment program for jails and how in Indio they're going from a 350-bed jail to a 1,600-bed jail, and how they would have probation services across town where they would have all these mental health services and things for people who are alleged criminals and convicted criminals. And in San Rafael, we had a program close, and we're getting referrals from that program closure. Our transportation went down in April, and we asked our staff, will you come to work an hour earlier? We know this is not part of your job, but will you pick up our clients and bring them to the program? And they said, sure. Most of my staff leave our place at 3 o'clock and go to other jobs as caregivers. Our clients were born with developmental disabilities for the most part. They didn't do anything to become this way. We as a society owe them these services because of the Lanterman Act and because they're human beings and people in our world. Please give us 10% to help stabilize our system so that we can be here again next year to ask for more money.
Thank you.
Hi, Krista Loomis, Full Circle of Choices, Contra Costa County. We do supported living and independent living, and thank you, Assemblymember Thurman and Bonilla, for your help. As an executive director, I wear many hats, always have, but the hats are starting to become very in conflict because there's the hat that we wear on provide quality services to people with disabilities so they can live a quality lifestyle in the community. And then there's the hat of where staff come to me and say, Krista, we haven't had a raise in 7 years. We're working really hard to do all those great things you've laid out in your philosophy, but we don't get a raise. How come? And then there's the hat that the auditors and the people that we just finished our fiscal year. So the auditors say to me, Krista, every month you're going a little bit more in the hole. What's your plan? How can you maintain this over time? What are you thinking of cutting? And So all those three things don't go well together. So for me, the only hope is that we can get this 10% so these hats aren't all pulling on me in different directions saying this isn't sustainable. We can't continue to provide support. I can't continue to work here because you don't pay enough, and we can't continue to go in the hole every month. So the 10% is critical to keeping us afloat. Thank you.
Thank you.
Thank you for hearing us today. My name is Maureen Fitzgerald, and I've been involved in this field, developmental disabilities, most of my adult life, either as a volunteer or a professional. I'm urging you to not let the task forces that are working on rates and regional center operations be used as an excuse to not do anything until the January budget, which means it would be next July before they'd see any relief. They truly are in desperate straits and need some help now. I'd like to also suggest to you, you've heard discussion of the task force and the rate work group and the regional center operations work group, what they're doing. Those meetings are closed to the public. Only periodically are the full task force meetings open to the public. And I think you, the legislature, and the administration would get a much better product and have much better dialogue about where can we go in the system short and long term. All sorts of issues if the public could go to those work group meetings, and I would urge you to urge them to open them up. Thank you.
Thank you.
Hello, my name is Jackie Dillard-Foss. One is I'm coming here as a California citizen. I work with people with developmental disabilities, Assemblymember Bonta, and when they say they don't think there will be public testimony and you say there won't be several times, they left the room because they trusted your word. So they came from far away and they left. They were challenged, and so I am frustrated as a California citizen that those valuable voices were not heard today. August 17th, does it scare me when you talk about that and that there will be public testimony then? We also know that's the close of the session. I was at the SB3 hearing yesterday on minimum wage, and I hear about the special session is going to address minimum wage. The minimum wage is not part of this conversation. That's a separate conversation. It's another unfunded mandate. I don't know how desperate we need to become. I'm not really sure how much more talking we need to do. I have been talking for a year. I have been talking till I'm blue in the face. I was talking to my colleague with the Supported Living Network, and the word we came up with is hopeless. I have never, ever in my 27 years in this field been hopeless. But this California legislature, this Democratic-controlled House, has made us hopeless. I want to read Stephen Colbert before I leave. It's not a Cuba Gooding Jr., but I think it hits home when I read it. It says, if this is going to be a Christian nation that doesn't help the poor, either we've got to pretend that Jesus was just as selfish as we are, or we've got to acknowledge that he commanded us to love the poor and serve the needy without condition, and then admit that we just don't want to do it. And right now, the California Democratic Party doesn't look like wanting to do it.
Thank you. And let me make just a clarification about the legislative calendar in case there's any confusion. We're coming back to session on August 17th. We'll continue until September 11th in the regular session.
Thank you. Tony Anderson. I'm the director of the ARC of California and also represent United Cerebral Palsy. But also here today as a representative for the Lanterman Coalition, which is the coalition of all the organizations in our developmental disabilities community. And our main message at this point in the special session, you have clearly heard our message throughout the year, and the statements made today, it's very clear that you have heard what's happening to this collapsing system, and the statements behind me are ahead of me. But what we want to continue to push on is that there was a lot of anger and disappointment at the end of the budget session, and I know many of you felt that as well. But there was some hope that was presented to our community about the special session. And the special session, to us, isn't something that can continue out into the far future. It's got to be now. And there's got to be the urgency. We heard it today in this hearing about the urgency of this collapse. There are organizations in our communities going out of business now, and they're the large ones now. Not the small ones anymore, not the middle-sized ones, the big ones that are the ones who took up the slack when the small ones went out of business. So this is the sign of the total collapse of a very large system of supports for very vulnerable people. And for us, this is 3 weeks in to the special session. That may not seem like a long time, but to us, every day is another day where somebody else is going to go out of business or our family is going to have no support for their loved ones, and they'll be at home. Maybe they won't be able to contribute to society and their jobs or in their lives, and their lives get impacted as well. And the whole variety, as laid out earlier, little children all the way up through retiring individuals, all with unique needs, and all impacted because of the many years of this collapse. So again, we're going to constantly push on, please treat this as an urgency, because every day something bad is going to happen. Thank you.
Thank you.
Thank you for allowing us to speak. My name's Lynn Vaughn. I'm a medical case manager for a supported living agency here in Sacramento. I just want to take you back through history a little bit. You know, in the 2014 year, SB 856 created the Health and Human Services Agency Task Force to address the developmental centers and what was going on with the community services. They met 7 times between August 25th and September 11th, and the result? I didn't see any action from DDS. I didn't see anything going on. This year, SB 639 was signed into law. It sets the closure plan. You guys had to set the closure plan because they weren't doing anything. And you did it because of public outcry, not any other reason. Yesterday, I sat up there and they voted on SB 3. I'm not putting my faith in another task force to save this community. January 1st, it's coming. Another minimum wage increase is coming. And what I see in a future with inaction here is that there are going to be tens of thousands of people with developmental disabilities, homeless or incarcerated, and unemployed direct service people in the hundreds of thousands. That's on you.
Thank you.
Good morning. Amy Westling from the Association of Regional Center Agencies. First, I wanted to open by thanking the members of the committee and your staff. We appreciate the attention that you're focusing on this issue. Second, I want to take us back to something Santi Rogers always reminds us of, which is that services for individuals with developmental disabilities are there to give them a good life. And unfortunately, because of underfunding in the system is challenged to do that today. We're seeing people sitting at home without appropriate services. We're seeing providers going out of business. And we're seeing caseload ratios rise. Mr. Rogers today referred to case management as the bedrock of the regional center system. And because of underfunding of the system, we just don't have enough staff in the regional center system to provide individuals with the services that they've been promised. And we're putting lots of federal dollars at risk as a result. But more importantly than that, we're at risk of not providing people what we promised them. We promised them a good life, and that's what they deserve. Thank you.
Thank you.
Hi, my name is Nicole Buslog. I am here on behalf of myself and my staff. I live alone, and I'm afraid that I won't be able to continue to live alone. I lost one of my staff last night because we didn't have enough money for her. So please remember us. and our staff. Thank you.
Thank you.